Time now for this week's Health Matters with PA Lynn Szabo. How you doing today, Lynn?
I'm doing good. I'm bringing you news of another chronic viral illness that causes worldwide death.
Well, yeah, sure, but it's a different one.
It's a different one, and it's one that people probably have and don't even know it, actually.
Wow, all right. So what is this we're talking about today?
So we're talking about HPV, which is human papillomavirus. So it's a DNA virus. Most people who are infected have no symptoms. But the good news is that 90% of the infections resolve spontaneously in 2 years.
Really?
Yeah.
Wow. I guess I didn't realize it went away.
It does.
Okay.
And it actually, it's kind of not a one-way road. I mean, it can kind of wax and wane over the course of that. And sometimes people have symptoms and most people don't. So the most common symptom is no symptom. But some go on to causing oral and genital cancers, which is the bummer. So it's spread by skin to skin contact. So that means it's mostly sexually transmissible, but also transmitted during birthing process. So perinatally and in other ways. But worldwide, HPV is one of the most common infectious causes of cancer.
Wow.
Yeah, I know. It's kind of shocking.
I'm still I'm getting my head around the fact that viruses are linked with cancers.
Yeah, the first vaccine that was actually used to treat or to prevent cancer was hepatitis B vaccine. Yeah, because a lot of cancers come from hepatitis B virus, liver cancers. But anyway, with HPV, the transmission obviously mostly sexual, also perinatal, so from mom to newborn. But direct hand-to-body contact, so it doesn't really have to be sexual contact. And this blew me away. Shared objects like razors.
Razors?
Yeah, I know. It sounds so HCV, hepatitis C. We worried about razors, but now we have to worry about razors for HPV.
And it also sounds, it sounds like, all the strains of herpes that are just basically coming off of everybody all the time.
Right. Yeah, there's more herpes than the ones we definitely fear. But and new evidence supports that it's transmitted for blood transfusions, although the blood banks don't screen for it.
Oh, whoa.
Yeah, which is, definitely.
That seems like that could be a crisis in the making.
Could be.
Huh.
Could be. But also risk factors for surgeons because, possibly finger organ contact. But it does not come from toilet seats. It does not come from towels. It does not come from hot tubs. So none of that.
But how does it not do that if it could come from razors? And if surgeons have to worry about it?
Because razor is the blood thing.
Oh, it's a blood thing. Oh,
yeah,
I got you.
Yeah.
Okay.
Right.
I thought it was a skin thing.
Right. U.S. prevalence in people ages 14 to 59 is 26.8%.
Whoa. Okay.
So a little over a quarter of the people in the United States have it. So there are multiple strains. The high-risk ones for genital cancers are strains 16, 18, 21, and 32.
Whoa.
And the high-risk ones for oral cancers are strains 6, 7, 11, 16, and 32. So 16 is the bad player. Okay. The ones that are more likely to cause cancer do two really bad things. So the viral DNA integrates with the human DNA.
Oh, whoa.
Yeah. And it turns on the genes that promote cancer growth.
Isn't that what all cancers do, or is this different?
No, not all cancers are caused by viruses.
Sure, no, but by genetically altering or genetically hijacking healthy cells.
Yeah, in that extent, yeah. But here's the other really kind of nasty things it does. The viral DNA turns off and then gets rid of the proteins that are protecting us from cancerous cells.
That's insidious. Oh my God.
I know.
Wow.
So it turns on the on switch, and it not only turns off the off switch,
throws it away.
But it throws it away.
Oh my God.
I know.
It's like cancer's doing this on purpose.
Well, yeah, like the viruses.
No, I guess so we're still talking of the virus. This isn't the subsequent cancer, but this is what the HPV does.
This is the road to get to cancer.
Gotcha.
So things like alcohol and cigarettes are modifying factors that make the whole thing worse. Mm-hmm. Okay, so remember I said that it's not like a one-way street. You can go back and forth.
Yeah.
So if you're headed toward a bad diagnosis with it and you can modify some risk factors, then you can turn that train around.
Wow. If you're still on the viral side of the train before cancer itself develops. Wow. Okay. Okay.
Yeah. So how do we prevent this? This is not shocking. Immunize.
Immunize.
Yeah. So the two most common immunizations are Gardasil and Gardasil 9. Gardasil was the original one, was originally marketed in the United States for girls and women as a prevention for cervical cancer.
I remember when that happened, yeah.
But it did so much more, and they never really marketed it. That's part of the reason I'm talking about it today. So Gardasil 9 is the updated one that just covers more of the strains, and they both protect against the evil strain 16.
So you're saying that the vaccines did so much more, and that wasn't made part of the PR campaign because they just focused on cervical cancer, as opposed to all these other things that HPV.
So other things can be, well, I'll just whip through them. So anal cancer, let's see, penile cancer, head and neck lymphomas, head and neck cancers. And actually, most of the cancers that I've seen related to them here in Humboldt County were actually in a couple of young men that I had contact with through the walk-in clinic who had head and neck cancers that were probably HPV related.
Oh my gosh.
So we're not immunizing young men. Part of the reason I'm talking about this
All
today.
right.
Because if you talk to a parent of a young man in the room and you talk about getting immunized with Gardasil 9, they say, what? He doesn't have a cervix, so we don't have to do that.
Yeah.
But you're protecting him against so much more.
That might be a follow along from that kind of poor marketing at the outset. I remember when the HPV vaccine came out, and it was for cervical cancer, so it seemed like it was for girls. And they didn't. Yeah.
Well, the other thing is a lot of girls and women have sex with men and boys.
That's what happened. I know.
And there's that.
But you should. I think they should maybe have also said, and for the guys too, you need this as well. This is something that gets passed around.
Right. So right now, Gardasil 9 is FDA approved from ages 9 to 45.
Wow.
So ask your provider about this immunization for yourself and for your kids if you and they fall through, in that age group. If you think about it, parents are raising kids to be adults, right? So you're trying to teach them adulting skills, like how to drive, like how to, do algebra, I suppose, like how to write a check. Maybe that's archaic. How to deal with the lady at the bank, all that kind of stuff. How to send a letter certified. So we should be talking about how they protect themselves from this cancer-causing virus.
Yeah, definitely.
So think about what they need to stay safe and healthy, and then set a good example for your family. But here's the problem with this that I see is I asked around at the two clinics I work at, and I said, hey, I'm seeing people for routine the physical exam, let's say a 30-year-old male, can I offer him Gardasil? Because it's FDA approved. And first of all, everybody kind of looked at me blankly. And then secondly, they say that they get most of their vaccines or the Gardasil from vaccines for children in California. And they don't cover that age group. Although it's theoretically possible to get one and probably medically advisable to get one, it's not, realistically available.
Wow.
In this community, which kind of blows me away.
So you're just talking about the Gardasil for an adult,
right?
Regardless of
9 to 27, you're covered, and 9 to 18, you're definitely covered by vaccines for children, and up to 27, you could probably go to the public health department, and I think it'd be plus or minus whether your insurance would cover it, and it is kind of an expensive one. I think it's about $150.
Wow.
But wouldn't that make a great Christmas present for somebody? That's my kind of Christmas present.
Exactly. I had to laugh about that.
Yeah.
Because, that could also be kind of, great aunt get you soap on a rope kind of thing. But to say, that's obviously an act of love. Here, I got you this vaccination.
Got you covered. Maybe you didn't think of this, but
that's a good
idea. Another
idea.
adulting thread.
All right, everybody, I know you're getting shots.
Woo, Merry Christmas. So the other thing is, if you can't get immunized or you choose not to get immunized, then there are modifiable risk factors previously mentioned. So smoking and drinking are modifiable risk factors. And I would add chewing tobacco on that, because the two young men that I referenced before were both chewers. And one guy, I remember he said he was laughing out loud. He threw his head back and laughed. And so his tongue must have gone up to the roof of his mouth, and his friend spotted the lesion.
Oh.
I know. And so he didn't even know about it. He couldn't feel it.
Yeah.
It was underneath his tongue. As far as he knew, it was not there.
Oh my God, I hate that.
Yeah. So
I hate that. I heard a story once of a healthcare provider professional somewhere who just like randomly checked their navel and found like skin cancer, but just kind of randomly checked inside the belly button and didn't ordinarily do that. And oh my God.
Yeah, there's a local physician who actually had melanoma on his retina. It was found kind of incidentally. I mean, and Bob Marley, we all know Bob Marley had melanoma between his toes. Who looks between their toes, man?
Yeah, good point. But how do you get it on? I mean, I know how you would get it on the retina, but how do you detect it on the retina? I mean, just some sort of eye thing that wasn't
Go in and
working
get glasses, get your eyes dilated. They find it accidentally.
Oh
or
my God.
I don't know if this physician had diabetes or anything, but they look at retinas if you're diabetic.
Okay.
Yeah, stuff like that. But it's creepy.
Wow.
Yeah.
Cancer. Shake my fist at cancer.
I know.
It's such an insidious disease.
It is. It's a lot of diseases.
A lot. That's what I was going to say.
Really clear about
not
that.
just one disease.
It's not just one.
Each cancer is unique and snowflake-like. Great.
Yeah.
So, Lynn, apropos of nothing in particular, what can you tell us about pancreatitis?
It's a real bummer. It hurts. It hurts.
That's what Mike is saying.
And people can get it for a lot of different reasons, and some of them can make other people, like healthcare providers, a little judgy.
Yeah, right.
There's really no reason to be, and it's recurrent. And I'm sorry for anybody that has it, because I imagine they're miserable.
Yeah, no, actually, and that's what, if you hear all the tap dancing going around in the background of this week's Health Matters, it's because we've got Mike's dogs in the house here, Taylor and Shadow. And it's mostly Taylor. Shadow's taking a nap. And so Mike Thornton, as we've talked about, he's in the hospital, and everybody knows, and he's posted about it.
Okay, he's out with that.
Yeah, we're not violating any medical privacy here. So yeah, I was just curious, and he's talking, and it's antibiotics, right? Because is it an inflammation like a bacterial sort of thing, or I don't even know.
Well, it's probably multiple diseases, but it's inflammation of the pancreas. I could suppose that somebody would end up being in their treatment being treated with antibiotics for a complication, but that's not standard.
Okay.
Usually we put people what we call NPO, or put a tube down to drain their stomach. And NPO means nothing orally, so you're not really getting anything into your stomach except maybe what you swallow with saliva. But and you kind of give the pancreas a rest.
Okay.
I suppose medications could cause it. Alcohol is a common thing. And sometimes people get it because their cholesterol is really high, and their triglycerides in particular are elevated. And usually with those people, you can look at their blood, and the serum, which is the yellow part of blood, kind of looks like if you mix flour and water together. It's really white and cloudy and thick.
Wow,
and gross. So,
I mean, more than just blood.
Yeah. So, wait a minute.
Yeah, I know.
Not all of us think blood is gross.
That's the line. I'm on one, you're on the other.
Yeah, there you go. And it is, it's mostly a tincture time and rest to get better. And I hope it never happens to anybody more than once, although it commonly can.
Oh my gosh. Yeah. I've known a few people who've experienced pancreatitis, and some have been, drinking related, and some have just been incidental, and it kind of, but it's, oh man. Yeah. That's what I've heard, is that it's basically, just for lack of a better medical term, it's a bitch. It hurts a lot.
Oh, it is. And it is not without a certain amount of mortality associated with it. So I hear Mike's improving, though. So.
He is improving. He says it comes and goes. I just saw a message here. He had a thing about, we were talking about the dogs, and he had a thing about there being, they're right now, like, he'll feel okay for a while, and then he feels bad and chills, and then he gets better again, I guess, as treatment is building in him.
Yeah.
But Yeah, we'll get him back, and we'll wheel in. I don't know. We'll get a hospital bed for the Fug House, and attach a mic to it, and wheel him right in here.
That would be super cool. I'd be interested in hearing what his experience as a patient is.
Just as a patient at Sutter Coast. Mm-hmm. Okay. All right. Well, then maybe we can talk about that next week.
I think for medical people, there's opportunities to learn to do better, or maybe he's going to say, despite the downside of pancreatitis, Sutter was a super upside, and he was well taken care of. So we'll hope for that.
I always look. I look forward to hearing that as well, because in the community, Sutter's got kind of a really bad reputation, and that goes way back to before it was Sutter. That's just how we Seasick Hospital and all the stuff it was before, and all the names, Slaughter Coast, and all that stuff. I've interacted with Sutter maybe a handful of times and have nothing but good stuff. I have nothing but good experiences across the board.
Yeah, I'm aware of most of the people that work there. At least I was, I think I left my association with them about 7 or 8 years ago. Mm-hmm. And at this point in time, the people who are still there they have to have some hardcore dedication to the community, because sometimes there's not much of an upside to working there.
So there are people who were still there who were there a decade ago when you were associated with. That's actually reassuring, because you read about another sort of medical management company coming in and taking over the ER or whatever. I would assume there would be. And the fact that there are lots of doctors who drive up, from Humboldt and people from out of the area who come here.
Yeah, farther than Humboldt. They actually fly from out of the area.
Jeez, really?
Yeah.
Flying in? Wow.
Yeah, they do.
Wow.
But we have physicians like Sandy Saunders, who has been there, 20 years, maybe 25 years. And, rock star, #1 in her class, always there, always seems to get the night shift, always is the one working when nobody else wants to work.
Oh, my gosh.
And lives in a pretty humble situation here in the county, but still gives the rock star evaluations for people. I love reading her workups.
Wow, what's her role? What does she do? What kind of medicine?
She's an emergency room physician, and she's been through Valley and Sound, I guess is the new one, but in a bunch in between.
What's that mean, Valley and Sound?
Those are the entities that
have come in
provide staff, and what really happens is administratively they change, but usually the people on the ground don't change much.
Okay.
So there's some super people there, and I imagine it hasn't been easy for all of them.
Yeah, not just COVID or anything, but just across the board. It can't.
Right.
Well, yeah.
But
Tell me, is it easy to be a healthcare provider in this county, in this community?
No, but no better place to make a difference.
Yeah, that's
true.
So
if your healthcare provider is into the helper high, guilty, then this place has kind of got constant material.
That's wonderful. I'm going to have to bring that up as a condition. I'll have to talk with my wife about that, because it really enjoys being helpful. And I'll have to ask her about the helper high.
The helper high is what we call it. Yeah.
That's great. That's really cool.
Yeah. But anyway, there's some great people there. I'm sure that Mike is getting great care, and I'd be interested in what he has to say about it when he gets out.
Okay, we'll debrief, and I do expect him, barring any sort of complications, to be back for next week's Health Matters.
That'd be great. And I'm thinking of talking about obesity.
Okay.
Yeah.
What about it? Pro, con?
Frustrating. Frustrating, super frustrating.
Have things changed in America? Have we made any sort of headway against all of that? As far as the number of obesity, the prevalence of obesity?
I actually don't think so. And I think that patients get told all the time, well, your knees hurt because you're overweight. And then the discussion from the provider stops there.
Okay.
And so I want to look beyond that. And I think sometimes medicine doesn't give people very many practical things, to do to address a problem. Okay. So I'm going to talk practical.
All right. Interesting. I look forward to that then. That'll be next week's Health Matters. Thank you so very much, Lynn.
All right. Thanks.
Flash. The sun did not rise this morning. Large cracks have been seen in the earth and rocks are reported falling from the skies. More details in 30 minutes on KFUG.